When I was about 9 years old, I fell out of a hayloft. The story of how I came to fall out of that hayloft would be the subject of a whole other talk. But today I'm going to talk about the consequences, which were much more interesting. And what happened in falling out of that hayloft was I dislocated my wrist. And it hurt a lot. Now, back at the beginning of the 1960s, your parents didn't take you to A&E when you'd hurt yourself. So what my mum did was run my rather sore arm under the cold tap for a while and sent me to bed and said, "We'll see what it's like in the morning." Well, in the morning, it was no better. We lived in a place that was a long way from the nearest big hospital, so I was taken to the local cottage hospital, where I met a doctor. Now, as I recall him, this was a bit of a rather old-fashioned man. He had a tweed suit, he had that sort of Sir Lancelot Spratt manner, and he went about his business. He x-rayed my arm himself. He put some anaesthetic in my arm himself. He then proceeded to manipulate my dislocated wrist himself. He then put on the plaster of Paris himself. It all seemed rather simple, and I was very impressed. In fact, I was so impressed, probably to my granddad's eternal sorrow, I gave up the idea. I let go of the idea of being a farmer, and I said, I am going to be a doctor. Some 20 years later, I found myself training to be a GP, and I was working in CLIC. And one of my jobs in CLIC was to go to the cottage hospital in the mornings. And sometimes in the mornings, I would find myself using the X-ray machine myself. I would find myself putting in anaesthetic to numb someone's arm. I would find myself manipulating somebody's arm. I would find myself putting on the plaster of Paris. It was a success. I had set myself a goal and I had achieved it. And I have to tell you, for the next few years, I worked in a practice not far from CLIC. I had a fantastic time being the GP that I wanted to be. Being that kind of self-sufficient expert and doing a great number of things that I thoroughly enjoyed. But over the years, a little bit of doubt began to creep into my mind. And I'll share with you one of the things that happens to us doctors. Somebody comes in, maybe one of you, but somebody will come in and start to talk and tell you their story. And you find you know much more than you want to know. Perhaps it would be somebody, a man perhaps, with advanced heart disease. And within the first couple of sentences of the conversation, you would know that that was what the problem was. You would also know that more than likely they'd been a lifelong smoker. More than likely they hadn't really taken much exercise outside of work. More than likely they'd never cared about their diet very much. I would know something else as well. And this is only 2 or 3 sentences into the conversation. I would know that it would take ages and ages for that person to see the local specialist. And the local specialist may or may not refer them to Newcastle for heart surgery. And if they did, it would then take ages and ages and ages for them to get their heart surgery. And actually, I'd be sitting there thinking, more than likely in a couple of years' time, I'm going to be, maybe one night, I might be in your house trying to treat you with a massive heart attack. Or worse still, I would be talking to your family about your untimely demise. By 1990, I'd had enough. It wasn't just heart disease. It was cancer. It was all sorts of problems, debilitating diseases, people waiting for surgery, some childhood problems. There were mistakes, there were delays, there were all sorts of things wrong. And I basically retrained. I retrained in public health and medical management and went off to be a system leader. And the 1990s was a great period for me. Again, I enjoyed being a GP. I enjoyed being the kind of expert leader, and I worked with clinicians in heart disease and cancer, people in mental health. It was a transformational time, the 90s. Some of you will remember the old long-stay hospitals where people with learning disability and mental health problems were just kept in asylum. They were all closed down. I worked with networks of clinicians to transform the way we dealt with heart disease, to change completely the waiting experience. We thought long and hard about the defects and the things that had been wrong with the service. It was an amazing transformational time. And it was all down to teamwork. It was all about the teams of clinicians who were working on new ways of dealing with heart disease or cancer. It was working with teams in academics I worked with as well. The university decided I should be a professor. We thought about everything from the prevention of AIDS to tobacco control. It was just an amazing period. The transformation was complete, I think, when they sent me to the palace and Prince Charles put a gong on my lapel and, who is this professor? And do you know what? There I was with my gong and my titles, and still it didn't feel right. The patriarchy and the paternalism, the prerogative of the NHS in the 20th century had led to a set of services where we experts knew what the right thing to do was, and we went about doing it. And it didn't feel right still to me, and I thought, well, I think this is something to do with teamwork, and I got more and more interested in leadership instead of management, and I thought, well, we can make the teams more effective, that might make it more right. We were still making mistakes all of the time, so I got very, very interested in continuous improvement, because like the cycling teams that we've all heard about, you can make them better by just lots and lots and lots and lots and lots of little improvements. So I became very interested in how we could do continuous improvement. I went to Japan and I learned all about it. And it was through that lens of quality improvement that I saw much, much more clearly, maybe 15 years ago now, what was wrong. We had built, and I had been part of building, an NHS which would fettle up anybody who had anything wrong with them as much as it could, and then put everybody else in a queue. What we didn't do was put the patient at the centre of what we were doing. The patient, with all of their experience, was not the one who was driving the change. The patient, with their experience of their disease, but also their problem, whatever the issue was, but also their experience of their community, was not involved in that expert dialogue about what we should do next. So I had this fantastic career, and I thought, hang on a second. When I look out across what we've done, just as I had let go of the desire, I'd let go of a ladder actually and fallen out of that hayloft. Okay, I'd fallen into a charmed and privileged career. I'd let go of being that self-sufficient GP, working in a rural community, doing things myself. And I'd gone into teamwork and realised that it was all about teams. And in fact, what we could do as a boss, what we could do as a leader was fantastic. We could transform the NHS. And the transformation was unbelievable. In my lifetime, I'd gone from handing out tonics in brown glass bottles. In fact, I remember the surgery when I started as GP didn't have a seat for the patients. They would come in, close the door behind them, back up against the door, and say whether they wanted the brown tonic or the blue tonic. And I would go, well, I think perhaps you need the blue one, and we would give them the, and off they would. We'd gone from that in my lifetime to ordering MRI scans. We've got robots now that do operations and stuff. But still, we hadn't got it right. Until we came down. I came down, I fell out of, I let go of that as well. I let go of being the boss and said, no. The people who really understand how a service works are two groups. The people who actually provide the service and the patients in the communities who benefit from that service. And whilst it is possible to have a fantastic career as a doctor, and whilst it is fantastic to be able to be an expert and to transform the NHS, the real transformation for us locally is when we can get the staff who provide a service, together with the people who use the service, be they patients or members of the community, to have that conversation about what we should do next. And for us, living in a rural community where it isn't easy to decide where to go next, that co-production, that working together, can only happen if all of us let go of what it is that we think defines us, and say, no, it's for you to have a conversation about where we go next. Thank you very much.